Hello, my name is James Bledsoe, and I am a physician working for the Arkansas Department of Health. And I have an expertise in heat stress, both as a physician and also as a participant in sports. As the occupation health consultant to this construction company, I've been asked to present to local general contractors about the dangers of heat stress. And I appreciate you allowing me to do that today. So if you will just listen closely, I think I can help all of you in understanding the causes of heat stress, the prevention of it, and also the treatment. Thank you. There are three main points to consider about heat stress. We will be discussing this at some length after this outline, but I think it's very important to understand what it is we're first talking about. First is the definition. Heat stress can occur when workers are exposed to extreme heat or work in hot environments. This leads to a reaction which initially may be merely becoming uncomfortable to the point that the person is having difficulty performing a task. So in short, the heat is becoming stressful. This can lead to hyperthermia, in which thermal regulation located in the hypothalamus is failing, and the body is absorbing more heat than it dissipates. In humans, the normal body temperature is 98.6 degrees Fahrenheit. A temperature above 99.5 degrees is the start of a body becoming overheated, while a temperature above 104 degrees can be life-threatening. At this stage, perspiration, evaporation, and blood circulation to stabilize body temperature is ineffective. Secondly, let's talk a little bit about the cause, and again, we will be discussing this in more detail later. Heat stress occurs when a person is working in an overheated environment, whatever the source and for whatever the reason. The signs and symptoms may consist of that heat stress exists. It can lead to a variety of early signs and symptoms. Workers who are over 65 years of age, overweight, have heart disease or high blood pressure may be affected by extreme heat. Early on, they may develop skin rashes, vomiting, headaches, or muscle cramps. As they become dehydrated, blood pressure will lower and fainting can occur. The skin may be dry. Loss of consciousness may occur with signs of shock, such as a weak, barely palpable pulse. And third, we'll talk a little bit about the prevention and treatment. There are engineering models and methods to control heat stress, such as increased air velocity, use of reflective or heat-absorbing shields or barriers, reduce steam leaks on wet floors or humidity. And the workplace recommendations include limit time in hot environments and increase time in a cooler location, increase the number of workers per task, use special tools to alleviate strain, train supervisors and workers about heat stress, provide adequate amounts of cool water near the work area, require workers to be self-monitoring, implement a heat alert program, and increase physical fitness. And the treatment, we will discuss this more in detail later. For exertional heat stress, start with resting in a cool shade or in an air-conditioned room. Drink adequate amounts of cool water and sponging the entire body and remove excessive clothing. If the person is not responding or is in already heat stroke mode, transport to an appropriate medical facility is vital. Some of the points to consider in the pathophysiology of heat stress is this. Fever can occur when the core temperature is set higher through the reaction of the preoptic region of the anterior hypothalamus. For example, in response to a bacterial or viral infection, certain white blood cells within the blood will release pyrogens, which have a direct effect on the anterior hypothalamus. This causes the body temperature to rise, much like raising the temperature setting on a thermostat. In contrast, hyperthermia occurs when the body temperature rises without a change in the heat control centers. Some of the gastrointestinal symptoms of acute exertional heat stroke, such as vomiting, diarrhea, and gastrointestinal bleeding, may be caused by barrier dysfunction and subsequent endotoxemia. Ultra-endurance athletes have been found to have significant increased plasma endotoxin levels. Endotoxin stimulates many inflammatory cytokines, which in turn may cause multi-organ dysfunction. Experimentally, monkeys have been treated with oral antibiotics prior to induction of heat stroke, but they do not become endotoxemic. So, there is scientific support for the concept of a temperature set point, that is, maintenance of an optimal temperature for the metabolic processes that life depends on. Nervous activity in the preoptic anterior hypothalamus of the brain triggers heat losing or perspiration, or heat generating, shivering, or muscle contractions. Activities through stimulation of the autonomic nervous system. These are what we are describing now. The preoptic anterior hypothalamus has been shown to contain warm sensitive, cool sensitive, and temperature insensitive neurons to determine the body's temperature set point. As the temperatures that these neurons are exposed to rises above 37 degrees centigrade, the rate of electrical discharge of the warm sensitive neurons increases progressively. Cold sensitive neurons increase their rate of electrical discharge progressively below 37 degrees centigrade. Let's discuss a little bit more about the diagnosis of hyperthermia. First of all, you must have a high degree of suspicion. If someone is in a situation such as extreme exercise or in a hot environment and otherwise is healthy, then you must exclude hyperthermia. Frequently, this is all that is needed, but particularly if the body temperature is high unexpectedly. Hyperthermia is generally diagnosed by the combination of unexpectedly high body temperature and a history that supports hyperthermia instead of a fever. Most commonly, this means that the elevated temperature has occurred in a hot, humid environment, causing a heat stroke, or in someone taking a drug for which hypothermia is a known side effect, such as drug-induced hyperthermia. The presence of signs and symptoms related to hyperthermia syndromes, such as extrapyramidal symptoms characteristic of a neuroleptic malignant syndrome, and the absence of signs and symptoms more commonly related to infection-related fevers, are also considered in making the diagnosis. If fever-reducing drugs lower the body temperature, even if the temperature does not return entirely to normal, then hyperthermia is excluded. The prevention of hyperthermia is certainly very important. When ambient temperature is excessive, humans and many animals cool themselves below ambient temperature by evaporative cooling or perspiration or other aqueous liquid. Sometimes saliva in dogs is a good example. This helps prevent potentially fatal hyperthermia. The effectiveness of evaporating cooling depends upon humidity. Wet bulb temperature, which takes some humidity into account, or more complex calculated quantities such as wet bulb globe temperature, which also takes solar radiation into account, give useful indications of the degree of heat stress. In cases of heat stress caused by physical exertion, hot environments are protective equipment. Prevention are mitigated by frequent rest breaks, careful hydration, and monitoring body temperature. These should be attempted. However, in situations demanding where one is exposed to a hot environment for a prolonged period or must wear protective equipment, a personal cooling system is required as a matter of health and safety. There's a variety of active or passive personal cooling systems. These can be characterized and categorized by their power sources and whether they are personal or vehicle mounted. Because of the broad variety of operating conditions, these devices must meet specific requirements concerning their rate and duration of cooling, their power source, and their adherence to health and safety regulations. Among other criteria are the user's needs for physical mobility and autonomy. For example, active liquid systems operated by chilling water and circulation through a garment, the skin surface area is thereby cooled through conduction. This type of system has proven successful in certain military, law enforcement, and industrial applications. Bomb disposal technicians wearing special suits to protect against improvised explosive devices use a small ice-based chiller unit that's strapped to one leg. A liquid circulating garment, usually a vest, is worn over the torso to maintain a safe core body temperature. By contrast, soldiers traveling in combat vehicles can face microclimate temperatures in safe core body temperatures. This can reach excesses of 65 degrees centigrade and require a multiple user vehicle powered cooling system with rapid connection capabilities. And requirements for hazmat teams, the medical community, and workers in heavy industry vary even further. Basically, it's just common sense. What you do and how you handle things like this is very important. In a normal reaction to heat, the body has a prescribed mechanism of response. Perspiration, as has already been mentioned, vasodilatation of skin vessels. And also, we have noted that the heat stress caused by physical exertion, hot environments, hot clothing such as protective equipment, other reasons that promote excessive heat retention are inability for the body to cool. We have mentioned several things causing heat stress. The most common thing we see is heat stress in usually agricultural workers, and they're much more apt to have heat stress or even heat stroke than the average civilian job. Also in young people, physical exertion, particularly those who are unprepared for hot weather and are extremely stressful situations such as a football practice. And we have some very interesting things about this. But physical exertion is one main thing. Also just being in hot environments with or without much physical exertion. In enclosed buildings, some civilian workers, they're much more prone to have heat stress than someone in a well-ventilated building. Hot clothing, such as that, is worn in protective equipment. People who have certain jobs, they have to take extreme precautions, as we've already mentioned. Otherwise, they will become heat stressed. There are other reasons that promote excessive heat retention or inability of the body to cool. We'll talk a little bit more about them, but we've already talked about some of the more important ones. The treatment of heat stress is very varied. It depends on the cause of it. First of all, the underlying cause must be removed. Mild hyperthermia caused by exertion on a hot day may be adequately treated through self-care measures, such as increased water consumption and resting in a cool place. Hyperthermia that results from drug exposure requires prompt cessation of that drug. Other drugs may cause other problems, and these must be ceased as well. When body temperature is significantly elevated, mechanical cooling methods are used to remove heat and to restore the body's ability to regulate its own temperatures. Passive cooling techniques, such as resting in a cool, shady area, removing clothing, can be applied immediately. Active cooling methods, such as sponging the head, neck, and trunk with cool water, and remove heat from the body and thereby speed the body recovery. So, if these do not work, a person must be sent to a hospital immediately. There they will be given other ways to cool the body temperature. Some even means abdominal dialysis, other means with IV fluids that are cooler. But at the same time, these are professional measures, and we must not take it slightly, just how dangerous heat stress can be. Let me just again go over some of the reasons that we use this and some of the easier ways to lower the body temperature. Some of the passive cooling methods I've already mentioned, such as cool water to the forehead, drinking water if the patient is not nauseated. Active cooling methods, though, require things such as being placed in ice water, immersion, and this is really the gold standard. If you can do this, sometimes you're in a position where you can't altogether do that. So in a case like that, you have to do what you can basically to cool the body temperature. So, as I mentioned earlier, if these measures fail to lower body temperature or if it exceeds 104 degrees Fahrenheit, these people must be rushed to a hospital. Epidemiology of hyperthermia is quite variable. It does vary even from year to year and in the same location. It depends on many factors, such as heat work or factors in the workforce. Many farm workers, as I've already mentioned, die from heat stroke at a much higher rate than U.S. civilian workers overall. There's a lot of research in hypothermia, and some of it has been in deliberately induced hypothermia using drugs or medical devices. It's been used in the treatment of cancer. There's much research that has to be done on that, and it's not routinely used in all cancer treatment, obviously. Unfortunately, there are many lessons to be learned from tragedies. Tragedies are always painful, but they can lead to a better awareness and understanding of a complex problem. The Kendrick Fincher Hydration Foundation was founded just after such a tragedy. Kendrick Fincher was a young boy who was playing football starting out on August 7, 1995. It was during that time that Kendrick experienced a heat stroke. After 18 days in intensive care at Children's Hospital of Little Rock, Kendrick died from complications of heat stroke. As parents, they made the comment that they did not want this to happen ever again with any other parents who had children playing in sports. So the Kendrick Fincher Memorial Foundation was developed to ensure children have proper hydration during athletic activities and that they have squeeze bottles with them at all events. Because of Kendrick's death, procedures have been changed in the sports programs at the local schools, not just in Rogers, Arkansas, but nationwide. The family wishes to make certain that schools or other teams nationally provide information on heat illness and prevention. Their vision is this: to improve the safety for athletes and a reduction in the number of injuries and deaths from heat-related causes of all ages. Their values were this: all children should have adequate access to throughout the school day to promote proper hydration. Athletes should have frequent water sports, drink breaks. Athletes should be able to get a drink at any time during practices. Coaches should be trained in heat illness for prevention and emergency procedures. Parents should understand their child's hydration needs and encourage proper hydration. Their mission was to promote proper hydration and prevent heat illness through education and supporting activities. Gentlemen, these are some of the sources that I've used for my talk. I certainly hope that you will take into consideration what I talked about today. This is a very complex issue. It's something that in a 15-minute talk, it's impossible to give all the aspects of it, but I think we touched upon some of the major things. And basically, I hope that you will just take into consideration prevention is the best thing to do, and certainly in something like this, in heat stroke. There are treatments for it, but the death rate is very high once full-blown heat stroke is involved. Again, I appreciate you allowing me to talk to you today. It's been a great pleasure on my part, and I hope you have a safe work field schedule yourself. Thank you very much.